During the first lockdown, the NHS issued a COVID-19 decision support tool. This was based on assessing patients on their suitability to be given intensive care treatment. So anyone who scored 8 or above was not permitted access to intensive care and instead were just given on the ward treatment, or in some cases were left at home. Now, how this was scored was based on 3 criteria: age, frailty index, and any comorbidities. So anyone who was over age 80 was assigned the number 6, and if they were very fit or well, they were given 1 or 2 on top of that, and if they had any comorbidities, they would get points as seen here. So basically, anyone who was over the age of 80 was denied intensive care treatment, and that basically meant that they would be put on ward treatment, and if the ward treatment failed, people would be put on end-of-life palliative care, and of course would end up dying on the ward and would be quoted as being a COVID death. Now, part of the reason for this frailty index scoring was to make sure that there was capacity kept in ICU wards for younger people who were deemed to have more chance of survival. But what the official NHS data shows is that there were over 4,000 ICU beds in February 2020. That was increased by a further 1,500 beds when the pandemic broke. But what we see right through 2020 and 2021 is that capacity of ICU wards was never exceeded. So it was generally around 70% of capacity. So even without the new beds, ICU was never over capacity from its previous 4,000 beds during what was meant to be a deadly pandemic. So these ICU beds were sitting empty while patients were being denied medical care. These were deaths that were caused by the COVID response and treatment protocol.
Why were so few people getting to hospital in the first place?
Well, right at the very beginning of the crisis, the London Ambulance Service decided to make a change to the way that they admitted people. They had something called a News 2 score, in which when they went to see somebody, they assessed them to work out how ill they are and whether they needed to be taken into hospital. Normally, someone who scored 5 would be taken into hospital, but they increased it to 6. And we've spoken to doctors about this, and they say that if those people had actually been in hospital, some of the score of 6 or 7 would actually be in intensive care, let alone just taking them into hospital. What it meant was that they were being highly selective about who they took in. That in turn meant that a lot of people were left at home.
And George, what role were GPs playing too in all of this?
We got hold of an extraordinary document that was sent out by the Buckinghamshire NHS Trust, which was asking GPs to urgently identify all patients who were frail or in the later stages of life and then score them based on their frailty. And the purpose of that was to draw up a list of those who might be persuaded to stay at home when they became seriously ill rather than take them to hospital. The document was explicit about its reasoning for that. It said it was doing this because intensive care was, I quote, expected to far outweigh capacity by several thousand beds over the next few weeks in the southeast region due to COVID-19, and that there was a limited staff base to look after sick patients in our hospitals.
When they got in, they found that there was a porter guarding the door to the ward, and there was a big red sign on it saying, "Do not enter." They were allowed to enter, and they say what they saw was just horrendous. Vivian describes it as a death ward. Her father was in the far corner, but there were about 8 elderly people, all on their beds, and she describes them almost in nappies, drugged and barely conscious. She said it was stiflingly hot in there, and she could barely catch their eyes because it was just so sad. And she saw her father, who was in a bad state. He seemed to be hungry and he seemed to be very thirsty. And they say they were there for a long time, and in that time, no nurses came in and out. It was almost as if this ward had been just left. And certainly Vivian felt that people had been left to die in that ward. And in fact, while they were there, one of the people died next to them in the bed, and nobody was there. They had to go and find a nurse and tell them that somebody had died. And when they were outside the ward, they bumped into an auxiliary nurse who was in tears, and she said, "They're all going to die. and nobody's doing anything about it.
That's horrendous. I mean, that's the last thing you want to hear when your father's in a ward.
Absolutely. I think they felt that the 8 people in that ward had just been left to pass away because there was nothing they could do for them. The family, on the other hand, just cannot understand why Raymond and the others were not given intensive care to at least have had a chance to save their lives, because it didn't seem as if anything was being done. And this was especially galling for them, as the day before they'd been told that their father was not sufficiently ill to stay in a ward which had been turned into an intensive care unit.
So what had gone wrong here? Why wasn't Raymond placed in intensive care sooner?
We simply don't know. What we suspect is that hospitals were having to triage quite heavily. By triage, I mean they had to choose between which patients were allowed to go into intensive care and which would not be allowed to go into intensive care. It was like choosing between lives, in a sense. Those patients who did not go into intensive care frequently were the ones who scored high in terms of age, their frailty, and possibly they also had some sort of illness as well that would have scored against them. And the family say that they were told by the doctor that it was a tick boxing exercise. And it seems that Raymond just didn't make the cut in terms of the score when he was triaged. Would describe the document as Nazi-like.
Wow. Its ability to pick and choose who gets treated and who doesn't.
Absolutely, yeah. The first document was so stark because you would not be admitted to intensive care if you had a score of over 8 and you were scored 9 for being over 80. And even if you're 75, you would get 7. And on the frailty scale, if you were coping well and very healthy, you would still get a 2. So therefore, people who were coping well and over 75 would also be immediately excluded. And it just went down because from 60 upwards, you could be excluded because of an illness, because of your age, because of your level of frailty, etc. And this document, according to people we've talked to, was never officially accepted. But what seems to have happened with the document is that it was in circulation in the NHS. A second document was made, which was very similar, which was called the COVID-19 Decision Support Tool. Exactly the same, apart from it slightly lowered some of the scores. It was still very easy to exclude over 80-year-olds, over 70-year-olds by totalling up the scores. And both these documents seem to have been circulated in the NHS.
One of the doctors the team spoke to worked in intensive care in the Midlands, and what they told the Insight team was shocking.
During the height of the pandemic, not a single person over the age of 75 got into intensive care. The result of that was that 90% of the deaths in his hospital happened on the wards and only 10% happened in intensive care.
Do we know who would make the decision? I mean, was it doctors using this advisory system who got to decide, or does it happen further down in terms of triage?
So it was the guidance, but it was given to consultants on the wards, on the COVID wards. And according to the intensive care doctor in the Midlands, dozens of intensive care beds were left empty because under the criteria of the tool, not enough patients were qualifying for intensive care to fill them.
And yet patients were dying.
In their dozens, yeah.
How did this impact the total death toll?
So we're able to get data from the government's best monitor of what happened in hospitals during that first wave. And those figures show that of all the people who died of the virus in hospital during the first wave, more than half were over the age of 80. But only 2.5% of patients who were admitted to intensive care were of that age group. What we can also see is the proportions of the elderly getting into intensive care changed over that first wave. So in the middle weeks of March, before the first wave had peaked, 13% of over 60s admitted to hospital with the virus were given an intensive care bed. By the start of May, once the peak had arrived, that figure had more than halved and was down to 6%. But then once the pressure eased again by August, that had increased back up to 11%, which gives you a sense of how the triaging was dictated by the capacity of the hospital.